Hi, this is Jessica DeMassa with WTF Health. I am here at the Bayer G4A Accelerator launch in New York City, and joining me right now I have Dale Beerman. He is the co-founder and CEO of Pacifica Labs, which has a different mental health application. And so the way you described it to me is that it's actually one that people really, really want to use. And so the question is, why do people really, really want to use yours as opposed to all the other ones that are out there?
Yeah, a lot of tools out there are designed by clinicians. They're designed from the perspective of the mental health professional. As a result, they don't necessarily integrate with our daily lives and how we expect to use tools. So we really come at it from the perspective of the individual and how do we create tools that they want to use. So they need to be designed well, they need to be usable, and they need to be a joy to use. And I think that's really kind of our bread and butter and why a lot of people have really reached out to us for a solution.
Okay, so you had a really pretty impressive number of engaged users that you have. So how many is it again?
We have over 2 million total registered users. We're doing in the hundreds of thousands for monthly active as well.
All right, so tell me a little bit about the engagement. Like, how long are they spending? What are they doing? Tell me about a little bit about this amazing experience you're providing.
Yeah, well, mental health affects us all in different ways. So it can be very cyclic. So someone might download the app and use us for a couple weeks and sort of think they're getting better and sort of step away from it. And then 3 months later, they'll have another bout of stress and come back. So we have a lot of interesting usage in that we kind of compare ourselves to a dating app in some ways.
Okay.
If we're doing our job, they don't need us as much. So there's some management that needs to go on there, but we really look at it from the perspective of giving them a tool set that they can use sort of at their own pace without really being forced to go through the motions and really look at this like you would a 50-minute therapy session, for example.
So talk to me a little bit more about that, because one of the other things you said to me was that it's like, like the meditation part of this is like a sliver of what we do. So if that's the sliver, what's the rest?
Yeah, obviously meditation's been hugely hyped lately, which is great. It's creating a lot of awareness. But we are a cognitive behavioral therapy app, so we allow you to track your mood and health ratings over time. We'll provide suggested activities, so maybe a meditation, but thought activity, a daily goal. We have a set of guided paths that you can really follow. We have a hope board. We have social communities to help people connect around shared experiences. So our real goal is to help individuals establish better daily habits around our mental health.
Is there a particular mental health disorder that you find that you guys are really killing it at, as far as like getting connected with the people who are using this and like making a difference in terms of their health outcomes?
Yeah, it's pretty general. Stress, anxiety, depression. Okay. We all have these issues in our daily lives. So we really go beyond looking at just the individuals that would be sort of quote unquote clinically anxious or depressed. We really provide a tool set that we can all use to better manage some of the daily stresses in our lives as well.
And how do you think the future is going to unfold as far as like mental health and like just being engaged with like, I guess, an app on your phone? Like, do we still need mental health professionals? I mean, is there going to be a place for them? Is telehealth going to take over? Like, give me your prediction as far as this space is concerned. I mean, even broadly, more so than where your app is at.
Yeah, I think we're going to see a lot of modification in how therapy is provided. But we are always going to need the mental health professional. We've been very clear about that. We're not trying to replace them. In fact, we have an adjunctive tool, a clinician dashboard that allows them to facilitate treatment with their patients directly through the mobile application. So we want to sit alongside that, help make their jobs more efficient, more effective, and really get people through therapy faster and make sure that we're improving outcomes in doing so.
How's their engagement been? Because, I mean, especially in an era where it's like we're talking about physician burnout, they are tired of typing into the EMR, and now this is another digital thing for them to do, and it's separate. So how's it going?
Yeah, we have work to do there, honestly. I mean, we are another tool. So we need to build better practice management solutions for them so they are using a single platform that they can engage with. That said, the people that are using it with their patients are really excited. They're seeing increased engagement. They are seeing people get through therapy faster, and they're seeing that individual sort of take hold of their mental health and really drive it forward themselves in a way that we haven't seen, I think, in this space before.
That's awesome. So it really becomes more of a partnership that then kind of grows into like the person really taking control of their own behavior.
Exactly,
right?
yeah.
That's fantastic. Well, thank you so much for joining us. Again, the company was Pacifica Labs, and so people can find you where?
Search for Pacifica on the App Store. We are thinkpacifica.com.
Okay, awesome. Thanks so much for joining us. This is Jessica DeMassa with WTF Health.